Before advocacy, before legislation, there was a hospital room. There was a ventilator. There was a husband being told I might not survive. There was a woman screaming in pain while someone debated whether she had too much medication in her system. That woman was me. My name is Ingrid Kitty Trim, and I didn't choose this fight. I survived it. In 1996, at 23 years old, a car accident left me permanently disabled with a seizure disorder and debilitating migraine headaches. The medications didn't control it. Some made my seizures worse. Some didn't work at all. I was a young wife and mother, and I learned early that medicine doesn't always have clean answers. But I kept going. Then in 2015, my body nearly collapsed under something entirely different. A gallstone the size of a golf ball tore through my gallbladder, ripped into my small intestines, and lodged there. It created a fistula. It destroyed my tissue. What doctors first feared was cancer turned into something just as life threatening. The surgeries were rare, complicated, and one had never been performed in the United States before. I survived. But survival is not the same as recovery. More surgeries followed: hernias, mesh, complications, a body that never fully healed, and a body that had multiple surgeries before due to having children. Then in August of 2018, I went in for what was supposed to be a simple hernia repair. Within days, I was septic. Emergency surgery, medically induced coma, ventilator. Twice I was told I would not make it. After one emergency surgery, I woke up screaming. Not crying, not moaning, screaming. I was already on multiple pain medications. The IC doctor in charge, not my surgeon, refused to give me anything more. He said I had too much in my system. I begged my husband to end it. I told him I couldn't do this. My husband called my surgeon at home. My surgeon drove to the hospital in the middle of the night. He walked into that icy room and ordered fentanyl himself, telling the nurse to get it now. The IC doctor in charge came in and stated that I had too much in my system, and my surgeon said to him, "It doesn't matter how much she's on. She needs relief. You get her relief. You locate the problem, you monitor, you look for the cause so we can stop the pain. That's how good medicine works, doctor, not leaving your patient in pain, wishing to die." Finally, the screaming stopped. Someone understood. God bless that man, my surgeon. That is what real medicine looks like: relief, monitoring, investigation, care. Later that night, my body crashed from infection and I was placed back into a coma. Twice, death tried to take me. Twice, I survived, and I thank God he allowed me to live. After 53 days in the hospital, they told me I could not go home. They said I needed to be transferred to a long term care facility, and they gave me a timeline of 2 weeks to meet discharge requirements because they did not believe I could recover enough to leave. 2 weeks. 2 weeks to tolerate wound care, 2 weeks to come off IV medication, and 2 weeks to walk. The other two were accomplishable, but the last one, walking, was impossible. I had been laid up too long. Even my loving, caring surgeon came in to have a talk with me and told me it wasn't going to happen. I walked out and won. That fight, that refusal to accept what they thought I couldn't do, that's who I am. After all, I wouldn't even let death take me twice over when everyone thought I wasn't going to make it. About a year later, I was dismissed from pain management. Not because I did anything wrong. They decided no longer wanted to treat pain patients, as a lot of doctors were trying to get out of. Shortly after that, my husband went to work inside the Texas legislature. I was frustrated on the outside. He was seeing the system from the inside. I wrote letters, I emailed lawmakers, I called offices, I testified in Austin asking them not to take away Delta 8 because it literally kept me alive when I could not get proper medical care for 2 years. It felt like nothing mattered. I almost gave up. Then one day I saw someone online trying to organize chronic pain patients. They were suggesting the same things I had already been doing for years. I responded, "It won't work. I've been trying. Nothing changes. No one cares." But then something clicked. We weren't wrong about the structure. We weren't wrong about the cause. Years earlier, my husband, who's been in politics for 40 years, had taught me how legislation really works, how power actually moves. And somewhere between surgeries and dismissals, I had forgotten that. Going through that dismissal is what made me remember. I went to him and said, "This is going nowhere. We need to do this differently. This is how we do it." We had ideas no one else was using for the chronic pain community. And when we looked for an organization structured properly, one to build the work within the law and the legislative system as it actually exists, there wasn't one. So we built it. P.A.R.T, Texas. Pain Awareness, Right to Treatment, what it stands for. And I will keep pushing until patients are no longer left screaming in rooms while someone debates what is too much. Because this isn't about politics, it's about dignity. It's about making sure no one is abandoned because treating pain became inconvenient. It's about restoring the balance between patients and physicians, where medicine is practiced with courage, monitored with responsibility, and guided by compassion instead of fear. And it gives us the medical freedom with a doctor patient relationship. P.A.R.T Texas exists because I lived what happened when that balance breaks, and I refuse to let it stay broken. Thank you.